Today we're wrapping up our series on sexual dysfunctions and disorders with a focus on pain disorder. It's a condition that can affect both men and women, causing discomfort, anxiety, and even fear around intimacy. So back in studio for this discussion is Dr. Mark Opperman from the T Clinic. So Dr. Mark, I think the best place to start is just an understanding of exactly what is a pain disorder in terms of sexual dysfunction.
Michael, it's literally any kind of pain that you experience during a sexual encounter that diminishes your experience of enjoyment and pleasure during that specific session.
And what would be the cause of this kind of pain? Or I mean, I imagine it's various different kinds of pain that you could experience.
Yeah. Michael, I think the most common one that people would be familiar with is something that's physical. And this could be dryness, specifically in women. This could be because of underlying conditions like endometriosis or a bladder that's prolapsed. For men, Peyronie's disease, where there's a curvature of the penis, which is painful when it gets erect. But now we can also have other conditions, psychological condition, vaginism. Vaginism is where there's an involuntary spasm of the vulva with any kind of stimulation or intercourse, and it really, really is painful for women, and can preclude them from having any kind of sexual activity. And it's usually because of something in the unconscious or in the depression, anxiety, usually associated with some kind of trauma or abuse. And then there's also a condition, it's not common, but where with ejaculation or after ejaculation, men can have quite severe and even some excruciating pain because of a contraction of muscle, and it can stay painful for a while. It's usually associated with urinary tract infections or something like that, but sometimes it can be chronic, and you know, they don't want to have an orgasm, so they're not going to engage in sexual activity.
So again, this pain that people would be experiencing causes an avoidance of sex, which is not helping anything at all. Right?
And I think it's specifically common in women who have vaginism, where there's that spasm. They really do not want to go there because there's nothing that relaxes those muscles. And then women during menopause, when there's dryness, you know, it's not nice having sandpaper in that area.
Absolutely.
And it's not only during the actual activity, but it's afterwards also. You know, the mucous membranes have been torn, they're raw. We usually get infections, which leads to bladder infections. It's really not a nice condition.
How important is it that these are addressed as soon as possible?
Michael, from a health perspective, definitely something that you cannot ignore. I think we also underestimate pain conditions in younger women, for instance, endometriosis, or women who had assisted births where there was scarring of the tissue. It's now really, really sensitive. It's not pleasurable. So, you know, there's a lot that can lead to that. Men, I think another one other than Peyronie's, and Peyronie's is where there's connective tissue that precludes the sponge tissue from extending linearly, so you know, it also causes a lack of blood flow. And when you really get aroused, you know, that's painful to the point where the arousal will completely fail. But problems with the foreskin, where we have phimoses, etc., where the foreskin is either too tight and it becomes uncomfortable, or there's small little tears that happens because of intercourse. You know, but all of these are pain conditions that can be effectively addressed if you understand the underlying cause.
Right. And Mark, are these most of these things conditions that would develop and progress over the time, or are a lot of them sort of sudden onset and unexpected?
I think when we take a look at female pain conditions, the vaginal dryness, the atrophy, etc., etc. It's something that comes with time as we get older, as hormone levels start to decline. Endometriosis, women usually starts presenting with that from a younger age, and it can continuously get worse at different times. Again, we refer to scarring of vaginal tissue through episiotomies. That usually happens after childbirth.
Okay.
When it comes to vaginism, usually post-trauma,
Okay.
where we have, and that can be sudden onset.
Right.
Peyronie's, for the guys, it's usually a gradual onset. We need to identify the cause. Sometimes there's trauma to the penile tissue, which can lead to a quick onset of Peyronie's disease. Usually with that quick onset, it's also more extreme, and that can become painful quite quickly.
Okay.
But most men have some kind of slight curve, which usually doesn't pose a problem.
Okay. How important is it that if you are experiencing pain, you should be expressing this to your partner?
Michael, I think it's crucial to have a conversation. It can be addressed through something simple like a positional change, or using a device, dilating, more foreplay, something like that. But when it comes to a continuous discomfort, or consequences of discomfort after the sexual experience, where it continues, now to have a fulfilling sexual relationship or physical relationship, these things can and should be addressed. Again, I think if we take a look at what we've discussed over the past 5 weeks, sexual dysfunction is common in both men and women. It's highly treatable if you understand the underlying condition and focusing on that. There's physical attributes, there's psychological attributes, there's underlying medical conditions and medication that we use for these conditions. And discussing these with your healthcare practitioner, with your partner, goes a long way in solving them amicably and just making you more happy and more satisfied as an individual, but also in your relationships.
Absolutely. Mark, I think this has been a wonderful series of discussions because I've found it quite empowering to know that there is just so much that can be done and there's no need to sit and suffer in silence.
Yes.
And to share this conversation with other people as well, I think is important because to open up that discussion around sexual health and sex and enjoying it and letting it be a pleasurable part of life because it is so important. So thank you for sharing with us. I think it's been great value.
Pleasure. Great.